Oh yeah, I mean we're best friends now. He can't wait to hear my voice.
I told him a couple weeks ago, when I call you on a Sunday, that's not good. You start getting up to the statute stuff.
What is Sunday, Saturday? I mean,
they're all the same, right?
It's all national. Yeah. No lunch hour.
I know. Because it reminds me to get lunch. That's why
That's the whole point.
Good job.
That's kind of weird.
Yeah. Okay.
Aaron, would you like to lead us in the Pledge of Allegiance?
Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, welcome to the Shawnee County Board of County Commissioners. It is April 23rd, 2020, and with us today via telephone is Commissioner Kevin Cook, who represents District 2, and on my right is Commissioner Aaron Mays, who represents District 3, and I'm Bill Rippon, and I represent District 1. So, good morning, everyone.
Morning.
And do we have Commissioner Cook on the line there?
I am here.
Very good. All right. What is first on the agenda?
First, item 1, proclamations, presentations. Number 1, COVID-19 update, Linda Oaks and Dr. Gianfranco Pizzino.
Good morning, Commissioners. Linda Oaks from the Health Department. I'm going to start off, and I have some information for you, and then I'll turn it over to Dr. Pizzino. So just to give you a quick update, here's our dashboard for today, and Dr. Pizzino is going to talk about these numbers a little more when he gets up to speak. But so right now we have 96 confirmed cases. We still are holding at 5 deaths, and we do have 61 people who have recovered, so that is good news. We also have almost 2,000 negative tests, so I consider that to be very good news also. So I'm going to go through a couple of things that I think are going to be important coming up here as we move into the next phase of this response. So I want to start with talking about that the Kansas Department of Health and Environment has changed the definition of a person under investigation. They've broadened the definition a little bit, so anyone who has 2 of the following symptoms: fever, chills, rigors, malaise, headaches, sore throat, lower respiratory illness, some of the taste disorders, diarrhea, without an alternate, more likely diagnosis. So they will test these folks if they've had a close contact with a person with a laboratory confirmed case or just no source of exposure known. So that's a change. So on April 12th, Dr. Pizzino sent out an email to our health folks here in the community and asked for them to test a little broader. So he asked them to test people that had cough or fever in these categories: close contact with a confirmed case, history of travel anywhere outside Shawnee County in the previous 14 days, or a high-risk occupation, excuse me, which would be healthcare workers, first responders, excuse me, seasonal allergies, let me say, law enforcement agents, or residents or staff of any residential facilities, correctional facilities, homeless, nursing homes, long-term care facilities. So that is the testing criteria right now that we are still using here in Shawnee County. So I just want to talk a little bit about definitions. We've been throwing these words around, so I just want to touch on them and talk about what the health department is doing now and moving forward. So we have social distancing, quarantine, and isolation. So everybody should be social distancing. We want to keep that up. Keep your 6 feet and don't go to large crowds. Everything should be shut down right now anyway. So that is social distancing, and that's for everyone. Quarantine is for persons who have been exposed to someone with COVID-19 or has had the travel that we just talked about. people that are quarantined need to stay home. That is very important because if they get sick, then they have not exposed anyone else. So quarantine is a very important concept. You're not sick, but you still need to stay home and stay away from other people. Isolation are people who are actually ill. And so I'm going to go through a little bit of what we do when we find out someone does have COVID-19 and how we do contact tracing. So one of the things about isolation, if you get tested, you need to stay home, stay in isolation until you get your test results. So if they're negative, great, you can go back to the regular social distancing. If your test is positive, then you need to stay in isolation until you're symptom-free or you're fever-free for 72 hours, symptom-free for a week, fever-free for 72 hours without fever-reducing medication, whichever is longer. And our nurses will guide you through that process, so you don't have to make that decision on your own. We don't want people in isolation or quarantine going out for anything. Have people do that. If you need help, let us know. Let your nurse know. We want you to stay home. Try to stay away from other people in your household if you're in isolation and you're ill. So how does that investigation process work? What does it look like? So first of all, you get a test and you're notified that you're positive, and then you will get a call from the health department nurse. And that nurse will start the investigation, and she or he will ask you, where have you been, who have you been in contact with, and so we can start contacting those folks also and asking them to stay in quarantine. So it's very important when we call, you've had that positive test, that you talk to us and help us figure out where you have been. So if you think about it, someone who has COVID-19, they're in isolation, we have several people in quarantine because they've had contact with that person. If those quarantine folks get sick, they don't have any contacts because they've been home, they've been quarantined. So it stops the transmission of the illness. So it's very important that folks follow this, especially as we move to the next phase. This is one of the things that has to be in place, is a very robust contact tracing system, and so that's what we've been working on setting up and doing for the past few weeks. So we have lots of nurses working in this area and lots of people doing this work. So again, very important, if you're in isolation or quarantine, stay home, talk to the nurse if you need anything. And this is just a quick picture of our case contact team workflow. We have 2 teams of nurses that are doing the disease investigation. They're the ones who are calling folks and saying, you know, you have a positive test. They ask you questions like, where do you work? Where have you been? Who else is in your household? That's all important information for us to go ahead and do those contact those folks that need to be in quarantine. So we do need that information. We also need to know, especially, are you a healthcare worker? And a healthcare worker isn't necessarily a nurse or a doctor. It could be a maintenance person in a healthcare facility. So very important information that we get. And then we have a team, Team Deanna, down towards the bottom in the yellow. They are the folks who are continuing to call people every day, every other day to check on them, see how they're doing. They're calling the folks in isolation and quarantine. And then we have Team Missy. Missy Mendendorf is a registered nurse at the health department, usually works in maternal and child health. She is our nursing home liaison right now. So she is working very closely with the long-term care facilities, with the rehab facilities, with some nurses working with her to be sure they have a contact person, they're doing everything they need to do, they're getting the proper PPE, and I think that has been a very successful part of our response, and we'll continue doing that. Just a little bit about how you get out of isolation or quarantine. So again, if you have COVID-19, you're going to be in isolation at least 7 days. You have to be feeling well and fever-free for at least 72 hours without fever-reducing medication, whichever is longer. So you're going to be in isolation at least 7 days. Household contacts are a little trickier because when you think about it, they're exposed every day that person is sick. So their 14-day clock does not start until the isolated person is well. So they may be in quarantine. They may be in quarantine 3 weeks. It is a little tricky. It is a little confusing, but that quarantine time does not start until that isolated person is well. And then non-household contacts, 14 days is the quarantine period, and then they are free to stay home. So just one quick appeal to the public. Please answer your phone if you've had a test and you know you've had a test or you know the results. I know in this day and age, we don't like answering the phone. We don't know who it is. And I understand that. And there's a lot of scams and stuff out there. We're using multiple cell phones to do this work. So it may be a cell phone number, it may be a county number. But if you've had a test, please go ahead and answer your phone. You're welcome to hang up. If it is a salesperson, it's fine with us. But if it's our nurse, we really do need to speak to you. So I just make that appeal. A lot of folks don't want to answer the phone, and it really does slow down the investigation and make it difficult for us to do the work. So I'm going to have Dr. Pizzino come up. Just one more note, and it's just kind of a informational note for you. I know you're hearing, and we're hearing a lot about funding coming down to different entities. We have not seen very much money, honestly. I mean, you're going to hear today about one small amount of money we're getting from the Kansas Department of Health and Environment. There was a $500 grant. I'm starting to get a little concerned about that. We are piecing together grants as best we can, but we're not getting a lot of funds coming to the health department, and we've had to work a lot of overtime and a lot of extra hours. So it is something that does kind of concern me and keep me awake a little bit at night, is are we going to get the funding we need to, because this work is going to continue a year, 2 years. We have to keep doing these contact investigations so people can go about their lives. And so it is going to cost. We're probably going to need some extra help in the epidemiology department because we need to be looking at those numbers, which Dr. Pizzino will be talking about here in a minute. So I just wanted to make that comment that I am a little concerned about that. So do you have any questions for me before I bring up Dr. Pizzino?
Can I see that first slide again?
Sure. The slide or the dashboard?
Well, the dashboard.
Oh, sure.
Okay, we have 96 confirmed cases. How many of those cases are actually hospitalized?
I don't know any given day. Yeah, I think.
Very few. So a lot of these are just, they just send them home.
Or they're at home, getting
They
well
have-
at home. Yeah,
they
they're getting
have a
tested and they go
mild
home.
case.
Yeah.
What about respirators? We've heard a lot about respirators. How many people are on respirators?
Again, I think it's a very small number based on the hospitalization.
But we have no problems.
It changes pretty quickly. Yeah, but no.
I know we based a lot of our reaction to this virus based on some models that they did in England. Is that correct? Yeah. Also the United States. So one of them said that we might have as many as 4 million deaths in the United States.
Right.
And then they downgraded it to 200 or 2 million, and then now they're down to almost 60,000. Have we changed our response based on the new models?
I'm going to let Dr. Pizzino talk about that a little bit, but
Okay.
right now we're staying the course. We're keeping the response we have. Honestly, I think it's working. I'm feeling good about it right now.
All right.
Dr. Pizzino?
Good morning, Commissioners, and thank you for the opportunity to provide you with some information. To address the question from Commissioner Rippon, I think there is, I heard that comment made before. I think there is a big element of confusion here. The first projections that were made were based on the assumption that nothing would be done. So the projection was, this virus is coming, if we do nothing, this was going to happen. We may have 2 million deaths and maybe up to 4 million because people won't find a bed in the hospital, a bed in the ICU, or a ventilator to use. But that's not been the case, right? We have done a lot of things in Shawnee County, in the state, in the country. Because of those containment measures, those numbers now have been revised, but they're not the same money. We can't compare apples and oranges. So the apples were, if we do nothing, this is what's going to happen. The oranges are, since we did what we did, we may end up with 60,000 deaths, or perhaps even fewer. Still a lot of deaths if you think about it, but I understand your point. Between 60,000 and 4 million is very different. So that's the first element of confusion I want to clear, because I hear that a lot. It's the curse of public health. Actually, I wish I had the chart with me that I keep showing people, where there is a trajectory that goes up, and that is if we do nothing. It goes up and up and up, like many of the curves you've seen coming out of other countries. And then there is an alternative curve where the trajectory goes up to a point, but since there are some intervention, it starts to come down, and then it starts to come down. And at the point, you have people who start saying, see, you overreacted, it didn't happen. It didn't happen because we did everything we did. That's why it didn't happen. So that's really important to keep in mind.
Okay. Another question: what are the odds of survival if someone does? If say you're under 65, what are the odds of survival?
Under 65, I don't have those numbers memorized in terms of age groups, but clearly we know that most mortality happens in people 65 or older, or people with underlying
Pre-existing
conditions. Right.
All right.
I think the overall death rate from coronavirus will be known only when we start testing more broadly and we know how many people were actually infected.
Do you have any questions?
Yeah, I mean, I don't know if it's more of a statement probably, but I mean, I'm kind of surprised to see that we only have 29 pending tests right now. Since we've tested 2,000, I mean, it would, if you extrapolate it out, it seems like early on we didn't have the tests, and now it seems like they're more available. Are people just not coming in with symptoms, or are we choosing not to test people when they do come in, or what?
It's the former. I'm glad you're asking that question, because testing is one of the things I wanted to address in my comments. As Linda showed you, we have expanded our criteria for testing in Shawnee County more than what the state has done and other places in the state. The reason is because we knew that tests were available, and we knew that our hospitals and in part the state laboratory were not really working at capacity for testing, and we knew that we wanted to find as much infection as possible. I am very proud that we are actually in the top 3 counties in the state for testing rates. Those are rates, are not absolute number, it's number of tests per 100,000 population. We are in the top 3, and those top 3 are very close to each other. We are way above the average in the state, and we are way above counties, even large counties like Sedgwick County, where those rates are about half as our rate. There are 2 reasons you see fewer pending tests. Number 1 is that in absolute terms, we are performing fewer tests in the last week or so because there are fewer people sick. And not just with coronavirus, there are just, the influenza season is almost over, so you think about people with cough and fever, we just don't have that many people with cough and fever anymore. And number 2, the return time for our test is higher, it's faster. So at any point in time, you have fewer pending tests because we send it in, we get it out within a day or 2. So that's the reason, but not because we are not looking. In fact, we are looking really hard. We are looking even harder than before. And I think it's big kudos to our providers who have followed my recommendation. And when I told them we need to test everybody with cough and fever, we need to test everybody with cough and fever, there was a spike in the number of tests once we did that. I don't have the numbers with me, unfortunately, but I can get those numbers for you.
No question. So I saw recently that Johnson County did a random sampling of 500 citizens with a drive-through lane. Is there plans to do something like that here? I know they had sort of just mailed out notices to 500 people and then expected them to come in. Are we planning on doing something like that so we can at least find out, the people that are not showing symptoms, if people actually have it and are walking around?
Yeah. I would love to do something like that. There is no firm plan right now here or elsewhere that I'm aware of. I think what I would recommend is that we wait until we see how accurate those tests are. Those tests were just released in the last week or 2 through an accelerated approval process from the FDA. And there are some concerns about public health and medical researchers that the tests may not be as accurate as the manufacturers describe them. And the main concern is that since there are a large number of coronavirus types that circulate in the community, most of which we don't even know we have them, it could be a common cold or something like that, we don't know the extent to which there is cross-reactivity between those coronavirus and the new novel coronavirus. And if there is cross-reactivity, that of course will represent a problem, because when you have a test that detects antibody, you don't know if the antibodies are against the new coronavirus or one of the old ones, and the implications are huge, especially when you tell people, if you're going to tell people, you have antibodies, you're safe, you're not going to get coronavirus, 2019 coronavirus again. Well, that may or may not be true. So I think it's a great idea. I love to do that because that's really what's going to give us a sense of how widespread infection was in our, or still is in our community. We are not there quite yet.
So you're saying that there could be false positives then?
Yeah.
Okay.
Or
And it-
even false negative, we don't know. I mean, the test has just been deployed. But I think the false positive is probably more likely.
Okay. And I mean, is there concern with any of the other coronavirus strains, or is it just the COVID-19 that is the only one that we
The
should?
COVID-19 is the one that gives us the greatest concern because it's a total novel virus. And so what we are seeing now is a 100% of vulnerable population to a new virus. And that's why you see these big numbers of people infected and sick. I suspect what we may find over time is that the severity of coronavirus disease is actually not as much or as big as we thought at the beginning when China, was locking down a city of several million people. But the problem is that you have so many people infected that you are still going to overwhelm our hospitals with the number of people. So even if it's just a fraction of the people infected that end up on a ventilator in ICU, the number of people that are infected is so big that that's going to overwhelm our system, just like it has happened, and it is still happening in places like New York, Michigan, California, and so on. So that's why it's the main concern right now, because everybody is essentially susceptible until either everybody has been infected or we have a vaccine.
New York's kind of a different situation though, where they have 25,000 people per square mile, and
Right.
we have 280, something like that, people per square mile. So we're just not on top of each other like that. But even in New York, I see where they're kind of over the hump right now. They're dismantling some hospitals that
Sure. They paid a big price to get over that hump. I mean, when you have refrigerated trucks parked in the
it's hard to
parking
compare
lots.
their situation with ours because just their situation.
Commissioner, I wasn't trying to compare New York to Topeka. What I was saying is that that's why you see a huge amount of people in places like New York, so places where the infection can spread really quickly. So that was my point.
Commissioner Cook, do you have any questions?
Dr. Pizzino, as we and Linda, as we move forward and as we start to work through the phasing of reopening, and knowing that we still are a little bit ways out from that occurring, would you contemplate Shawnee County needing to purchase masks, gloves, gowns, or anything else for the public before they would be allowed to enter into public buildings such as the courthouse, the treasurer's office annex, Shawnee County North annex, the health department? Should these be items that we should be securing now so that we would provide those to people that would come in for the protection of all?
I think I will let Dustin Nichols address that because he's the one really who has the pulse of the situation in terms of personal protective equipment and such. Okay, that part I can address. So in terms of social distancing, our plan that I'm just now starting to develop and will be finalized within a few days definitely includes a component of social distancing that will be at some level. I think it will be with us for many months, but it will be progressively relaxed as we watch the effect of some of the measures being lifted, and we make sure that the infection doesn't really spread in the community, and we still have it under control. So in that sense, yes, there will still be some social distance measures required. Now, whether we have enough equipment for our public, for our first responders, that's the question I would like Dusty to address.
Morning, Commissioners. Dusty Nichols, Incident Commander, COVID Response Team for Shawnee County. I just have a few things to go over, just to kind of give you a broader sense of everything that's going on past the detailed stuff that the Health Department's doing. But to address Commissioner Cook's question specifically, we do have the inventory of surgical masks and N95s, those kinds of things that are, we still have a few on hand, but those are specifically tiered and prioritize for hospitals and healthcare workers, those kinds of things. As we do move forward in a tiered release plan, I should say a working document, because each level of that's going to have a lot of data going into it before it's implemented. But it is going to require, as Dr. Pizzino was talking about, people to wear masks and social distancing and those kinds of things. Now, whether the CDC or state or local health departments and the health officers decide that those masks are mandatory for everyone, I think that's the decisions have to be made as we step forward based on not just these numbers, but other stuff that's going on in the community. I think Dr. Pizzino was pretty, and Linda both were discussing these charts and numbers, and we're seeing a leveling off, if you will. But we're also hearing the anticipation of this thing, resurgence, hotspots. We hear, different counties that we didn't anticipate having cases suddenly have cases. So we are not obviously New York, but we are not Butler County. We're not Ford County either. So, but they're still seeing cases come up. So that goes into our decision making in these release plans and so forth. So as we move forward, first off, I need to say right off the bat, we don't have any ability to do anything until the governor's order expires in a couple of weeks. So we're in a holding pattern, but we're taking advantage of that holding pattern by analyzing data, making sure we have patient surge resources ready to go, making sure we have a tiered working document and looking at plans and assessments for over the summer. We just have stuff like the stampede and large gatherings to address here in the next couple of days. So a snapshot in time is just that. It can go either way. It can get better, or it can get worse. I plan for the worst case scenario. That's my job. If I wasn't doing that, then maybe these numbers would be way worse. So not taking credit for that wholly, but this team definitely saw what was coming, took steps, mitigated all that stuff early, put plans in place early, canceled events early to get control of this, and maybe that's a result what we're seeing now. And with the community's response in following those recommendations and orders, and even the state's orders, I think that had an impact on where we're at. And I want to continue this trend. And in order to continue the trend, we go with what works, and what we have done so far is what's worked. However, we need to recover, and so that's part of the reason 3 weeks ago we started the recovery task force, and we have a lot of community partners on that. Commissioner Mays, Commissioner Rippon, you are part of that task force, leading portions of that for the government and community. We also have health and behavioral section, economic section, funding and philanthropy sections of that, public safety. So that work is still going to continue to make sure that we're prepared for what's coming at us, and trying to get those best laid plans, if you will, to recover quickly and safely. Moving forward, as far as the safely part of it, one of those things that we're looking at is potential patient surge. As one of you mentioned, I'm not sure who it was, there's a potential of this flaring back up. So we need to make sure we're on top of that with those resources. So far to date, we've delivered over 11,000 surgical masks, over 1,000 eye protection or face shields, over 4,000 gowns, 300 Tyvek suits, 200 shoe covers, 30,000 gloves, 86,000 N95 masks. That's gone out through the SNS, and to those, there's over 34, there is 34 agencies that we've assisted. Some of those are nursing homes and the rescue mission. We have to take an extra step with the nursing homes and rescue mission to make sure the N95s have been fitted and tested. Richard Siegel, along with members of the 193rd Refueling Wing, are reaching out, testing those, providing those N95 mass fit tests, so make sure those are done right. We're providing training for those. Not that they were unprepared, it's just one of those things that you don't anticipate at those institutions, but we're getting them online and getting them the supplies and the resources we need. And to date, we've been really lucky with nursing homes. I want to continue that trend. I think that was early action has helped on that. Our safety officer, Richard Siegel, is also looking through patterns and materials for homemade gowns. We are just on the line of a critical shortage for those gowns, and not sure when we're going to get more. So much like the homemade masks that have been that have been accepted. We think we have a line on that, and after talking to the state, I know they're doing some of the same things to get crafters to make homemade gowns, but we have to disassemble some of those gowns to make patterns to get that out to those crafters and get those things done. So that'll be released here shortly. And then going back, one of the last things it's kind of the first thing I talked about, but it's also going to be the last thing I talk about. I want to remind people at the county level, at our level, the incident command team is maintaining. You can't start anything new until the governor's order is complete. We do have a working document. We do have tiered plans based on 14-day increments, 20-day increments, 30-day increments, because we have to, as we release that piece or that tier, we have to monitor and do exactly what we're doing here to make sure the next step is good to go. So it's going to be a slow process. It's just what it is if we're going to be safe. We can't, as Dr. Pizzino said, open the floodgate. It has to be a slow trickle. So we are developing that slow trickle working document, if you will. We'll be releasing some of that hopefully this afternoon once we get at least a synopsis of that plan out. I've been talking to event coordinators, trying to help them get an idea of that time and space that their event is in, and potentially the best case scenario that we can be in with this recovery with coronavirus. So I can stand for additional questions.
Go ahead.
Well, Dusty, I was going to ask you, a prominent member of our medical community made a statement in a news story yesterday that we've passed the peak of the virus in Shawnee County, and things are getting better and better. So could you speak to that?
Yeah, I'll talk a little bit if you, Dr. Pizzino might want to say something too. I will say that from that perspective of that individual, I can't say that he's wrong. I think we're all wanting the same thing, and we're seeing some of the same data. I think his what I took from it is his limited view from his perspective at his location is the same analysis we've had as well. I mean, we don't see a decline necessarily, but we definitely have a plateau effect happening, and I'll let Dr. Pizzino talk about specifically that and how that comes about. But the comments regarding we need to get back to get the economy back open, we agree. We've been working on that for 3 weeks. So none of that was a surprise to me, I guess, the comments that he said. It's something I believe Dr. Pizzino would say from his level, but I can't speak for him. So if you want to. Okay. So.
On our recovery teams, these committees, do we have anybody on there who's about to lose their business or somebody who's lost their job?
There is. I can't speak to that for sure because I don't know them individually as shop owners. I do know we have committee members on there that represent small business, that have the pulse of those small businesses, local businesses, whether they're small, and the defining factors, which I thought was interesting, and I don't have the exact numbers, but what defines a small business versus a micro business versus all those kinds of things are a little bit intricate, but we do have a full cross-section of every part of our community represented on that task force that are speaking to all levels of shop owners, whether it's a retail or whether it's a service or whatever kind of business they run. But we also have government infrastructure and the critical essential functions that need to come back online if they're not already working. With the governor's order, even the critical and essential functions are required to work from home where possible. We know we need to get the economy going. We're well aware. We're part of this community. We want to get everybody back up online as fast as possible. But fast as possible is very slow. And yes, I do know for a fact that we have representation of small business and across the community, all kinds of businesses on that task force. That was the intent of the framework we started 3 weeks ago.
Dr. Pizzino, what are the odds that all of us will come in contact with this virus at some point? I mean, we leveled the curve, but the curve, it continues on, so.
Well, first of all, let me say I'm not ready to say we leveled the curve. I think to monitor an outbreak like this in a place like Shawnee County, you need more than just a line like the one displayed here with the number of cases, because The number of cases is relatively small every day. In fact, we have gone last week 2 or 3 days without any cases, and then we had 3 cases in a day. So if you just look at that kind of line, it's going to be very bumpy. Those lines make, in the concept of peak, they make more sense in places where you have dozens of cases every day. Now, having said that, I think we are going in the direction where I want to see those numbers to go. And those numbers for me are not just the number of cases, they're things like who are those cases? Are these cases that these people who became infected from a source that we know, or these people that are just coming in contact with the virus, to go to your question, just randomly doing things in the community? Last week, I was really pleased that we had, I believe it was 12 cases, and out of the 12, only one was an unknown source. Everybody else, we knew how they got it. And I think 7 or 8 of those were close contacts to a previous person who was infected that had been identified by our nurses, and so they were put on quarantine. That's the kind of numbers that I want to see. So what's the probability we come across the virus? I think it depends on how active we are in the community. If you stay home, you won't. If you go out, it depends how crowded the places are where you go. It depends on how much virus there is circulating in our community, which again, we don't know, because we can't do the kind of service that Commissioner Mays was talking about earlier. I think it's going to be very different from person to person. It's going to be a sort of individual risk assessment that we all need to make to decide how much risk we are willing to take. I can tell you the probability is greater than 0. That probability is greater than 0 for most of us.
We have a lot of people at home now. Will this be a trigger for people who have drug addiction, alcohol problems, depression? Is that an issue we need to be concerned about?
We are concerned.
Okay.
We are very concerned. Commissioner, make no mistake, please. We are very concerned about this. We are very concerned about keeping people at home. I'm concerned about what's doing for our minority population. I'm concerned what's doing with people with diabetes and cardiovascular disease and high blood pressure who can't get those chronic conditions checked. So the concern is there. My greater concern at this point is making sure that we don't get overwhelmed by a virus that's circulating in our community. There are support systems that have been created for behavioral health and mental health. There are hotlines. We will not keep people at home one day longer than necessary, I can assure you.
Is there any value to releasing more of the younger people out first, people like, say, under 60, call that younger, because they're less affected by this disease? That's
yes.
the way I see the numbers. Or people who, not just younger people, but, well, younger people but tell older people or people with pre-existing health conditions to stay home.
Yes.
Is there any value to doing that?
There is, and in fact, it's something that most probably you will see in our recommendations once they are released. Is that at least for the first few weeks, we will still recommend that people with risk factors stay home, just stay home like they're doing today.
Any other questions?
Not from me.
Thank you very much.
No, sir.
Did Commissioner Cook have a question?
Commissioner Cook, do you have a question?
No, I do not.
Okay.
Did I answer your earlier question, sir?
Yes, you did. Thank you.
Okay. Lastly, I just want to again give thanks to the community for helping us get to this point, and we just need to continue that a little bit longer. Obviously, I want to give thanks to the team that's working this entire thing. It's an incredible team that are full of wonderful thinkers. Jim Crowell's assistants. There's always something that pops up. Yeah, I'm not a big fan of surprises, but we can turn those surprises into data pretty quick usually. So thanks to Jim for that. Also want to thank the media for getting the message out, because without them getting the message out, we might be in a real bad spot. So, and thanks for the leadership from the city and of course the county. So appreciate it. Stay at home. You're safer at home.
Well, hopefully we'll get through this quickly, and I'm hoping the governor lifts her stay-at-home order. I think it's time to move forward to the next phase and start our recovery. But that decision's made at the state level at this point, so We will wait and see. All right. Any other comments? Okay. Next item.
Item 3, consent agenda.
I would move that we approve the consent agenda.
I would second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Opposed? Motion carries 3-0. Next item.
Okay, take it from the page here. Item 4, new business, Ada County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have 3 voucher reports, and I'm going to go through them individually. The first voucher report is from April the 15th. It totals $824,927.72. The highlights out of that voucher report, under building and maintenance, a total of $214,990.38 was Carruthers Construction, and that was for the Shawnee North Aquatic, the wading pool, a total of $964,936. Also, Sene and Company of $35,662.05 for Hillcrest Community Center renovations, and then Tailor Made Company $10,312.05 for installation of safety services at Shunga Glen East Park. The other highlights were Department of Corrections for $311,128.41, which was primarily Horizon Health, the health care for the inmates, and then holding accounts with the state of Kansas of $93,382.53. The second voucher report is from April the 17th. That total was $1,049,030.47. The highlight out of the voucher report, the first is the payroll for our employees of $553,365.25, and then holding accounts with the state of Kansas of $197,069.10. Finally, there were 3 payments to Fannie and Turnip Seed. The first came under Bridge, which was $50,000 for the bridge inspection of Southeast 29th Street, and then 2 expenditures to Fannie and Turnip Seed. One was for $10,000 for design services for traffic signal system upgrades, and then $50,000 for design services for Southeast 45th Street from California to Coroco. The third voucher report was $1,701,912.08. The highlight out of that voucher report, the first was the Capers contribution, which was $329,072.95, and then followed by allocations, including Harvesters, Housing and Credit Counseling, Positive Connections, TARC, LULAC, and Topeka Youth Project, for a total of $284,512. Then we had Department of Corrections for $115,024.17, which was primarily Aramark Food for the food service at the Department of Corrections. And then we had holding accounts with the state of Kansas for $540,702.93, health insurance premiums of $121,892.03, and finally under Parks and Rec, a full collection of expenditures totaling $41,653.96. I do not have any questions regarding any of the 3 voucher reports and would move to their approval.
Second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I will move for approval of correction orders.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Bond Council number 1, public hearing on the issuance of Shawnee County, Kansas of its taxable industrial revenue bonds to acquire a warehouse facility to be leased to Walmart Fulfillment Services, LLC, and consent by the county to the company's request to the Kansas Board of Tax Appeals for an exemption for the facility from ad valorem taxation for a period not to exceed 10 years, The hearing will be open to the public solely for telecommunication. Those who wish to arrange telephone attendance may contact the board's administrator at 785-251-4040 on or before April 21st, 2020, and consider approval of resolution number 2020-22, authorizing the taxable industrial revenue bonds in the amount of $150 million and enter into a lease purchase agreement with Walmart Inc. or an affiliate entity or subsidiary thereof to finance the acquisition of property in Kansas Fire Commerce Park for a warehouse merchandising handling facility.
You can tell a couple lawyers wrote that. At the end of last year, JADO approved a incentive agreement with Walmart to construct and operate a merchandise and warehouse facility on about 200 plus acres of ground that sits to the west of the Mars facility. Part of that incentive agreement was that the county would issue its industrial revenue bonds in an amount not to exceed $150 million. The purpose of the bonds will be allowed to Walmart to self-fund the project. They're going to loan themselves the money. But through the structure, they will be able to get an ad valorem exemption for a period of time not to exceed 10 years on those project that was acquired with bond proceeds. It also allows Walmart to get an exemption from the Department of Revenue for retail sales tax exemption on those materials and supplies acquired with the bond proceeds. They want to close next Thursday, hence I'm here today. You're going to need to open the public hearing and then close it. From talking with Susie, nobody's called in by the deadline, but they needed to have 7 days full day to make arrangements to attend the public hearing. Nobody's made that arrangements, but I think the minutes need to reflect you opened it and then closed it, and then you can consider the resolution.
I'll make a motion to open this item up for public discussion.
I'll second the motion to open for public hearing.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. We're now in public hearing.
And I think you can
Mr.
close
Chairman,
Yes.
unless there is others that wish to add input, I would move to close the public hearing and adopt the resolution.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor say
Timothy Phelps
has left the conference.
Thought maybe you wanted to talk.
All in favor say aye. Those opposed, motion carries 3-0.
And now you'll need to consider the passage of the resolution.
He approved that when he does.
Did he?
Yeah,
It is
Oh,
motion.
good. Well, in that case, thank you. Thanks for getting these documents signed.
Thank you. Thank you, Bob. All right. We're looking forward to having them come to town and build that facility, and that will bring in a lot of jobs to speak of. It'll be much appreciated. Next item.
Item C, Health Department, number 1.
Steve Bauman
Has left the conference.
Acknowledge a funding award from the Kansas Department of Health and Environment for $40,533 for COVID-19 pandemic preparedness and response activities.
Good morning, Commissioners. Linda Oakes from the Health Department. This is some funding that has become available to us. It's part of the Coronavirus Preparedness and Response Supplemental Appropriations Act.
Is now
It is
in
a
the
one-time
conference.
funding opportunity. This was a percentage that the Kansas Department of Health and Environment allocated to local health departments. They also kept part of the allocation. They're going to be using that to help give us more support, testing equipment. They're working on some volunteers to help with contact tracing. So I think we'll see some benefits of the other funding too through the state, but this is our portion of it. And so I would be happy to answer any questions.
Any questions?
No, I'd move to approve.
Second?
Second.
Or
Motion.
to acknowledge, I guess.
Okay. Motion's been made by Commissioner Mays, seconded by Commissioner Rippon. All in favor say aye. Opposed? Motion carries 3-0. Thank you, Linda.
Thank you.
Next item.
Item C2, consider approval of a Kansas Health Foundation Impact and Capacity Grant application to assist with COVID-19 response and recovery for a total of $25,000.
Linda Oakes from the Health Department again. This is a grant application we would like to submit. It would be for $25,000. There's no match, so that would be the total amount. We've asked in the grant application to use it for software and equipment for case investigations and contact tracing support, personal protective equipment, prevention-based materials, and funding for communications and educational messaging. So we would easily use this amount if we are granted it, and I would be happy to answer any questions.
Any questions? I'll move for approval.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Opposed? Motion carries 3-0.
Thank you.
Next item.
Item D, Information Technology. Number 1, consider approval of request to increase the number of data plans in the existing Verizon contract for additional iPhone and MiFi units by a quantity of up to 60, $40 a month for each, with plans not to exceed $2,400 per month for up to 3 months, with funding from the 2020 IT budget.
Good morning, Commissioners. Pat Oblander with the Information Technology Department. Back in early March, the IT department began making emergency purchases of Verizon data plans to support MiFi units and iPhones that would be used by county workers that would be working from remote locations. We deployed about 30 PCs and iPhones and MiFi units during that early period, and got up to a count of about 30 data plans. And over that intervening time, we've found a few other plans that needed to be increased over that period of time. So we are asking for permission to set a limit of 60 plans that we might eventually reach that the IT department would pay for up to 3 months to cover those data plans. Those data plans do come with hardware that does not have any additional cost beyond the data plan, so we don't really have any discussions about what the hardware costs are, but we just talk in terms of the data plans themselves. So if you have any questions about what we're attempting to do, I'd be happy to answer those.
Any comments?
I have no questions.
What was that?
No questions.
No questions?
I don't have any.
Okay. I'll move for approval.
I'll second.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Pat.
Thank you, Commissioners.
Next item.
Item E, Public Works. Number 1, consider approval of resolution number 2020-23, establishing a temporary speed limit of 30 miles per hour on Southeast 29th Street from Southeast Wittenberg Road to Southeast Croker Road.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. We're just wanting to lower the speed limit by 10 miles per hour throughout the work zone. As you recall, last year we worked on the west leg of the Southeast 29th Street project. This year we're working on the east leg, and through that work zone we would like to lower the speed by 10 miles per hour, the posted speed that is. So, questions?
This is temporary for just during the
Yes, it's
construction?
temporary for the life of the project.
Okay.
So, Kurt, on the document that was provided, it says it's through December 4th. If the project is completed earlier than that, can we go ahead and change it back before then?
Absolutely. We'll take the necessary steps to do that. If it requires an additional resolution, we'll do it.
Okay, thank you.
Mm-hmm.
I will move that we approve.
Second.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item E2, consider approval of request to award bids for the following vendors utilizing the 2020 Public Works Special Machinery Fund. A, Traffic Safety Supply, $16,710 for a message board. B, Shawnee Mission Ford, $41,876 for a Ford F-250 extended cab. And C, Olathe Ford, $83,518.56 for a 2020 F-450.
Kurt Niehaus, Director of Public Works. These three items were approved back in August of 2019. as part of the 2020 capital improvement items. If you recall, back in February, we received bids on these 3 items, and they weren't as competitive as we expected, so we asked you to reject those bids, and you did so. These bids came in much more favorable. We have a message board. The low bid was around $13,500, but it was for a product that differed from the message board that we presently have. So we'd like to go with the second lowest bid, which is for a product that is nearly identical to the board we have now. So what we have is we have 2 boards. You have common parts. You have common operating procedures. We think that would be a benefit. Then we have 1 signing truck. Presently, we have 2 trucks. The truck that we're replacing has almost 300,000 miles on it. We would like to get this signing truck replaced. We received a bid that was $1,800 lower than what I consider the best bid, but it did not meet our specification. And then finally, we would like to replace the Supervisors Truck. The existing truck has 265,000 miles on it. The road maintenance supervisor averages 250 miles every 2 days. So we would like to get this truck replaced with your blessing. Any questions?
How much was that truck? You say it's a 450?
The signing truck is an F450.
I see.
Yeah, and then the supervisor's truck is an F250.
Okay, I'm with you. I haven't turned around yet. I have no questions.
Kurt, on the tabulation of bids that we received, it appears that on I believe the one that we're looking at here today, it gave us a pretty low trade-in allowance on that truck, maybe 1,000, I think. Am I reading that correctly?
It gave us $200, and the reason for that, I think you're talking about the sign truck.
Oh.
The reason for that is, again, the existing truck has almost 300,000 miles on it. Basically, it's shot. And so that's the reason for the low trade-in value. We are presently using both sign trucks, and the reason for that is we're trying to isolate people. So people are going to various job sites in separate vehicles. Normally, we have 2 sign trucks. The second one, again, has approximately 97,000 miles on it. We would normally, under normal circumstances, if we only need to have 1 truck out, it would be the one with 97,000. But right now, because of COVID-19, we're trying to separate the employees, keep them separated, so they may drive to a project site in separate vehicles. So the vehicle with 293,000 miles is actually getting a little more use now than what it would normally get.
Well, let me ask you, is the truck worth more than $200? If we need it right now for people to get around and to do their social distancing, I mean, is it worth maybe just keeping it for a little bit longer?
Well, we would keep it. I think what you're asking is not purchase the new truck and keep it and drive it. Sure, we can sure try that. We have some pretty good mechanics here at Public Works, and they have vowed to keep the vehicle running as long as we need to.
Well, so I think that's part of that's a consideration for sure. But I guess what I'm also considering is, if we're only going to get $200 in trade-in, perhaps we keep that truck and buy the additional one at the same time, and then we have 2 trucks, so that we don't have people riding in the cab together at the same time. I mean, if it's something we're using now, I get it. There's 300,000 miles on this truck. It probably needs to be replaced. But if we're only going to get $200 for it, if it's still got a little bit of value, perhaps we don't trade it in right now.
Aaron, I just want to clarify. We do have 2 signing trucks. So we would continue to use this truck until the new truck came in. So we always plan to have 2 trucks. Now, if you're saying go to 3 trucks temporarily, Yeah, we can do that. I'm trying to get our employees to not think that way. We have a lot of vehicles that I contend we may not need, and I'm trying to thin our fleet. I think 2 traffic control trucks is adequate. We won't be ever less than 2 because we'll continue to operate the truck we have now until the new truck comes in. And of course, then we've got the second truck with the 97,000 miles.
And Kurt, what year is the truck that we're looking at getting rid of or replacing?
Model year 2001.
Okay. So I know you and I have talked, and I do have some concerns with making such a large expenditure right now when we don't really know what our revenues are going to be for this year or for next year. There's just a lot of uncertainty right now, and I know that this truck probably should have been purchased a while ago. The bids didn't come back right. We were being responsible, went back out for bid. So I would probably go ahead and support the signing truck, but I don't feel like I could support the supervisor's truck at this time. So perhaps if it'd be all right with the chairman, if we could just maybe split this into 3 separate items for voting.
I wouldn't have a problem with that.
Okay.
Aaron, can I kind of add to that?
Yeah, please.
From a public works standpoint, if I had to prioritize the 3 items, I'd prioritize number 1 would be the sign truck. Number 2 would be the message board. It's a new item, but really 1 message board, if you have 2 message boards, that's more than 4 times, from an operational standpoint, it's more than 4 times more beneficial than having just 1 message board. And then the third priority would be the supervisor's truck. I'm telling the commission that to help them make a decision.
Okay, thank you.
Commissioner Cook, did you have anything that you wanted to add before I make a motion?
You know, I think that I understand where you're coming from on, wanting to extend and have the with the trade-in. I don't know. Why don't we just take these as 3 separate items, and then we can kind of take them and go from there.
Okay. I will move that we purchase the traffic safety supply message board.
I'd second that.
All right. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries. Item B is that's for the supervisor's truck, just to be clear. I'll make a motion to approve.
Second.
That wasn't the one that had the trade-in.
This is the supervisor's
That's
truck.
the supervisor's truck. So there's no trade-in on this one. I made a motion. Is there a second on that?
Second.
All right. Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed?
No.
I can go no on that as well. Motion fails. 2 to 1, I guess. Next item is for the sign truck. I will make a motion to approve sign truck.
I'll second it.
It's been
No.
oh, wait a minute. Without the trade, this is what do you say?
That's what I'm saying, just, that's what I.
Without the trade-in. Or with the trade-in.
With the trade-in? Okay.
Or without it.
Let's
go without the trade-in. Without the trade-in.
Yeah, I think it'd be good, at least
Okay.
for the time being, to just keep that truck, and then, if it ends up we don't need it after the new one's here for a while, then let's sell it.
Okay. I'll count that as your motion, and I'll second that. Motion's been made by Commissioner Mays, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you. Next item.
Item E3, consider authorization and execution of contract C-157-2020, amendment number 1 to contract C-34-2019 with Bettis Asphalt and Construction, Inc., to revise the completion dates and liquidated damages provisions regarding the Southeast 29th Street from I-470 KTA to Southeast Croco Road project.
Courtney House, Director of Public Works. Last year on the west leg of the Southeast 29th Street project, the contractor finished 8 days late, 8 days after the December 4th substantial completion date. They would have been charged $3,500 per day. Through negotiations with the contractor, I call it partnering, but through negotiations with the contractor, we turned each day, each penalty day, into 1.5 days during this construction season. So essentially what we've done is we've shortened this construction season by 12 days. So we turned 8 penalty days into 12 days that we shortened this year's construction season. So in a sense, rather than finishing up on December 6th of 2020, we'll finish up on November 23rd of 2020 by contract. Questions?
Kurt, I think it's great that you're working with our partners to come up with something like this rather than penalizing them. I'd hate to disincentivize them from bidding on future projects by punitive measures, so I appreciate this. And I'd make the motion.
Very good.
I'll second the motion. Motion's been made by Commissioner Cook. I'm sorry, Commissioner Mays, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Kurt.
Thank you.
Next item.
Item F, solid waste. Number 1, consider approval of request to award bid to Rurig Pacific Company for refuse and recycling containers at $43.59 per unit, delivered with funding from the 2020 solid waste collections operational budget, and approval to enter into contract negotiations for a long-term contract for ordering containers on an as-needed basis.
Good morning, Commissioners. Bill Sutton, Solid Waste. On February 20th, the BCC approved issuing a request for quotations for the various sizes of rollout containers that we use for both refuse and recycling. 3 vendors submitted bids for the sizes containers requested, and the tabulation of bids is attached for your information. Upon reviewing the bids, it is our opinion that the best and most responsive bid meeting our specifications is the Rurig Pacific Company at $43.59 per toter that delivered. They were not the lowest bidder. The lowest bidder had a disqualifying feature on their totes that does not work with, we feel that it is a liability to their product as over this Rurig. So we are asking to award the bid to Rurig and grant us approval to enter into contract negotiations for a long-term contract for ordering the containers on an as-needed basis to maintain our delivery for our new customers and replacement totes. Funding from this will come from our solid waste collections budget, which is 100% user fee funded and not taxpayer supported. Subject to your questions.
Bill, when you say long-term contract, what are we talking about here?
Looking at a 3-year contract, sir.
3 years. Okay. Is that a contract that we'd approve each year, come back each year, or is it a 3-year contract?
I would request a 3-year contract, sir. We can revisit it every year. That is not a problem. The reason that we like to go long term is right now I have about 60,000 containers out there on the streets. And our stock of repair parts is compatible with Rurig Pacific. Should we we go with another vendor, we'd have to get another stock of repair parts. So luckily, Rare Pacific came in as second bid, and that's why we like to maintain a long-term contract.
Okay, thank you. Any other questions? I move for approval for a 3-year contract.
This is just awarding the bid, and
Oh, it's,
you're authorizing my office to negotiate the
I
contract.
see. Okay, then I just move for approval. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed? Motion carries 3-0. Thank you, Bill.
Thank you, gentlemen.
Next item.
Item G, corrections. Number 1, consider approval of request to pay an emergency expenditure of $512 for pest control treatment in a training room at the Adult Detention Center facility, and authorization and execution of contract C-158-2020 with Ozark Integrated Pest Service, Inc. for future annual inspections at a cost of $50 with funding from the department's budget.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. Basically, this is just to ask approval for the emergency purchase or the services that we received for the mitigation of termites that we discovered in our training room area. That upon discovering the possibility that what we thought were termites, we had Ozark come in. Excuse me. They did come in and confirm that it was termites. They did treat the area and things like that, which was $512. But also that came along with this was just a service agreement, which we did have reviewed by the county counselor's office, and emergency purchase form did go through Betty Greiner's office. This is just in case we need to come back and treat the existing area again. We do have the money in our budget for this amount, and we needed to get it done. So I would stand for any questions you may have.
Yes.
Brian, while they were there, did they inspect the rest of the detention center?
Ozark comes in on a regular basis anyway to do any pest control and stuff like that. So they come in on there. But when it came to this, yes, they were there and they inspected the whole area of where they noticed it was the. Evidently, and I'm not, should I say, a termiteologist or anything like that, but come to find out that they were coming up through the crack, I guess, when they said they used some board or pressure wood or something around a cement column for expansion joints, that it came up from the ground underneath. But they did, to answer your question, sir, they did inspect the area and didn't find any other areas or anything like that. And again, we continue to have Ozark that does a routine inspection of the facility monthly.
Okay, great, thank you.
Thank you. Any other questions? I'm not a termitologist either, but I will move for approval.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed? Motion carries 3-0. Next item.
Thank you.
Item G2, consider approval of Kansas Department of Corrections grant application for fiscal year 2021 for adult and juvenile community corrections funding.
Good morning, Commissioners. This is Tim Phelps, Department of Corrections. What this item is our annual request from the Kansas Department of Corrections for grant funds that allow us to operate our adult and juvenile ISP work. And I put down the totals for the 3 specific grants that are being put forth, and I would be happy to discuss it if anyone has any questions.
Any questions?
I'll move for approval.
Okay. Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed? Motion carries 3-0. Thank you, Tim.
Thank you, Commissioners.
Next item.
Item H, Parks and Recreation. Number 1, consider authorization and execution of contract C-159-2020 and assignment of contract from Americrete, Inc., contract C-410-2019 to Americrete,
Has left the
LLC,
conference.
for general concrete work for the remainder of 2020.
Good morning, Commissioners. John Boyd, Parks and Recreation. We are seeking your approval to assign these concrete contracts. Americrete has gone out of business, and it was assigned to Mericrete. It involves all the same internal staff, and I'd be happy to answer any questions.
Any questions? I'll move for approval.
I'll second.
Motion's been made by Commissioner Rippon, second by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item H2, consider authorization and execution of contract C-160-2020 and contract C-161-2020 waste tire grant contracts awarded from the Kansas Department of Health and Environment for safety surfacing under 2 new playgrounds installed at Children's Park and Central Park with a 50-50 grant fund totaling of $13,527.98 utilizing excess reserve funds.
Any questions?
Good morning again, Commissioners. John Boyd, Shawnee County Parks and Rec. This is actually the result of getting your permission to go out for these grants, and we were awarded two sites that turns into a 50-50 grant. Help install rubber surfacing playground. And we are actually in a service contract with TaylorMade Surfacing, and they are an approved installer for this grant. And I'd be happy to answer any questions.
Any questions? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, second by Commissioner Mays. All in favor say aye. Opposed, motion carries 3-0. Next item.
Thank you, Commissioner.
Thank you, John.
Item I, Administrative Services, number 1, update on revenues and expenditures as of March 31, 2020.
Good morning, Betty Greiner, Director of Administrative Services. I'm here this morning with the financial overview as of March 31st. What I thought I would do is I will start going and I will go through the financials for the snapshot view as of March 31st, and then after that we'll talk a little bit about our general financial position and the future. So I will start here with revenues. Through March 31st, we had received revenues of $54,192,843. That is $167,000 over budget. So we are right on budget. That is 0.15%. So we are slightly, very slightly over in our total revenue. The first category is property tax revenue. We received $49,547,975. That is right on budget also. That is $463,000 over budget, and that is for mostly just the first half taxes for the year that we received. Next category is other tax revenue. We received $4,316,043. That is $147,000 over budget. So again, I would consider that right on budget. Charges for services, we received $1,299,796. That is $171,000 under budget. Most of that is attributable, as you can guess, to Parks and Recreation because of the year we're having. And this last category is other revenue. We've received $1,029,030. That is $272,000 under budget. That is attributable to investment income, which has dropped significantly, as well as indirect costs from our other departments. So you see the graph here. 88% of our revenue has come from property taxes, and that is because we receive most of our first half taxes in the distribution in the month of January. Then, let's see, then we look here. Oh, I'm sorry, I can't read the percentages very well. But the pie chart shows you the different categories and the percentages from those. We go on to expenditures. Through March, our expenditures totaled $28,734,337. That is $368,000 under budget, which is 0.33%. So there again, I would say, you know, we are slightly under budget on expenditures, but I would consider that close enough that we are right on budget. This chart just shows all of the expenditures and the different categories. The first category is law enforcement. The total expenditures are $12,348,329. That is $495,000 under budget. And the two categories in that were mostly under budget were the Sheriff's Office and the DOC. And as we know, that probably will be changing. But I will point out that even though we're $400,000 under budget, we have spent $466,000 more than we spent last year in that category. Next category is recreation. The expenditures were $5,047,761. That I'm showing is $535,000 over budget, but that, in looking into that, that is a timing issue. In in this year, they have gone into additional contracts like additional fleet contracts for vehicles with enterprise leasing, and then they have also expanded their contract for maintenance of parks with contracting that out. So when they have a contract like that, they encumber all of the funds at the time of the contract, so at like the beginning of the year. So those two items, the fleet and the park maintenance, those items are showing up as expenditures in the first of the year, where in the past years they have been spread throughout the year. So that's what I found in investigating this. So this is a timing issue. I will work with Parks and Rec, and we will adjust the budgeting for the rest of the year to account for that. What I normally do is I look at the prior years and what their spending habits were throughout the year, and that's how I come up with the monthly budgets for each department. So I will work with them and adjust that budget to take care of that. So like I say, this is a timing issue, and so it should look a little different next year. I will say that we have spent to date $587,000 more than last year, and there again, quite a bit of that is attributable to those contracts. Next category is public works. Expenditures $2,456,993, and that is right on budget. It's a little less, slightly less than last year, and there again, that's just timing issues. Public health, $3,233,418. That is right on budget. Administrative services of $4,615,753. That is $403,000 under budget. Two main areas that they're under budget in that are the contingencies, because we have not had to use much of our contingency money yet this year. And when I'm budgeting it, I spread it evenly throughout the year. And the other area is IT, and that is a timing issue. That we also know will change. And the last one is debt service. That has not changed since last month. We've spent $1,032,082, and that is right on budget. So this is just a chart that shows the different categories, and is a good visual of how much that law enforcement is by far our highest category. This is the pie chart showing those. 43% is law enforcement. Recreation is next with 18%. Public works is 8%, but that is only general fund money. Public health is 11%, but there again, that is only general fund money. Administrative services is 16%, and debt service is 4%. So, do you have any questions on that, the monthly financial review before we go into more general information? Okay, well then I would like to go into a little information on the 2019 results that we have had. In finalizing those the financial statements for 2019, our operating general fund increased by $1,459,000. So we added $1.4 million to our reserves in our general operating fund for 2019. So if you look at our operating general fund on a budgetary basis, now a budgetary basis is basically a cash basis, but you deduct any encumbrances that you had purchased. Anyway, so our operating general fund at the end of the year ended at $28,735,726. Now, if you look at our governmental general fund balance, which includes some just smaller auxiliary funds that GAP considers part of the general fund. So our governmental general fund balance at the end of the year was $33,177,435. And that does fall right at our goal for our fund balances that we had set by our fund balance policy. And so we are just slightly over what our goal was, which puts us into a good position going into this crisis that we have. I do want to comment on sales tax. I know with the city there's been a lot of discussion with sales tax, so I just want to remind you and let the public know that the county does not use our sales tax for operational costs. We only use sales tax for capital projects, so that any decrease in sales tax will not affect our operating costs. It could, the worst case scenario could delay some bridge culvert work down the road, but nothing, no major impact on the general public for that. I would like to talk a little bit about just the uncertainty in the economy, as we all know. And to be honest, we don't know the full effect of it right now. We don't know what that would be. We do know that it could affect our property taxes. Could very possibly have more delinquencies. The distribution of our second half taxes will come in June. That will really give us more information on how big of a hit we will get from this COVID-19 situation. Now, it's hard to know because, individuals, a lot of individuals pay, as they pay their mortgage, they pay into escrow for their property taxes and their insurance. So if they had enough paid into those escrows to pay their property taxes, we may not see the full hit of that. At this point in time, it's pure speculation because we really don't have any history or any data to go on. So when we get those June distributions, that will really give us a better understanding of how big of a hit we might get against that. The other area we know will probably get hit is Parks and Recreation. They will probably receive a reduction in fees. We have budgeted $2.4 million in fees from Parks and Rec. So there again, at this point in time, we just don't have any idea how much of a reduction we might get in those fees coming in, and how much of that reduced revenue might be offset by reduced temporary salaries. So some unknowns there. We also know that investment income is going to be down from what it has been. The Federal Reserve lowered interest rates to practically zero. So as they lower interest rates, our interest rates that we receive on income on that goes down too. I do want to let you know that we went into this pandemic with no securities that could decrease in fair value. So we are not losing any of our principal by the stock market or any of that. What we are losing is investment income. Any questions on that before I go on? Okay. Well, because of all these uncertainties, I would like to recommend to the Commission 2 steps that I would like you to consider. The first is that departments delay any of their 2020 capital outlay projects that can be delayed. I think just because of all of these uncertainties, if this is something that these are the ones out of the capital outlay fund, the $2 million that is allocated. Now, some of those have already been done. I think I sent you a list of those that have been completed already. So anyway, I just think it would be prudent that any of those that can be delayed are. We don't have any idea. You know, it may not be a very long delay, but we just don't know at this point in time. My second recommendation would be to ask all of the departments to review all of their expenses and just to ascertain that they are all essential. And part of that would be that no item should come to the Board of County Commissioners for approval without documentation of its necessity. You know, I think this comes back to that needs versus wants. I think at this point in time, with the all of the financial uncertainties we have right now, we need to make sure that we are only fulfilling those needs at this point in time. I think these measures will just help us to weather this storm. So that would be my recommendation to you.
It would be preferred if you would make a motion if you would agree with those recommendations.
Commissioner Cook, do you have any comments?
I don't have any comments. I think that we need to provide sound prudence right now. We need to be very cautious, and so I concur with the recommendation from Betty as our audit finance director. I'll make a motion to adopt the request as outlined by Director Greiner.
I'll second that. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Betty.
Thank you.
All right. Next item.
Item 5, Administrative Communications.
At this time, we ask any department heads if they have any comments they'd like to make at this point. Come forward.
Good morning, Commissioners. Aaron Manning, Shawnee County Emergency Management. Just want to take just a real quick minute to remind people that yes, we're in the middle of this COVID-19 crisis. However, as I've mentioned in past weeks and past meetings, please don't forget we're still in the middle of severe storm season. I don't want to be careful using the terminology, but we've been fortunate so far with weather, but there have been other communities in the Midwest that have been affected by tornadoes, severe storms, weather, things like that. So I would like to ask everybody just to please check your severe weather shelter-in-place kits, your emergency go kits, to make sure that the provisions are up to date, you have the right materials in there, food, water, prescription medications, things like that. Also, if you don't already have some type of a face mask or face covering in your emergency go kits, I would ask you find something to put in there that you can protect yourself with in case you do wind up out in public in some type of a mass shelter. Thank you.
Thank you. Anyone else?
Good morning, Commissioners. Bill Sutton, Department of Solid Waste. I just want to let the Commissioners and the general public know that earlier this week we received a request from the property owners up there at the North Dillons location off of 24th and Rochester that we remove our recycling containers up there due to some safety and security concerns occurring over the past couple weeks with illegal dumping and excessive scavenging. So as a result, we complied and we have removed those containers. We have plussed up our numbers at the household hazardous waste or the District 4 location out there off of 46th Street. And we would just like to thank Dillons for allowing us to utilize their property for the past several years as part of our recycling program. Our additional sites are on our webpage, So if the public would like to go to the webpage and find those drop-off locations, they're welcome to do so. Thank you.
Thank you, Bill. Anyone else? Hearing none. Commissioner Cook, do you have any comments?
I think that given the whole meeting discussion, looking at the outline from Dr. Pizzino and Linda Oakes at the beginning and then finishing up with Betty in our audit finance report, this is going to be a very cautious time for Shawnee County. We need to have a measured response and to our expenditures and be very aware of how this is going to impact us. And I think as department heads, we need to be very cautious in our expenditures. Additionally, this summer is going to be very different from past summers, and when we look at our sporting events and athletic events in our Parks and Rec and just how our parks work, and I think that we need to make ensure the safety of our citizens, but still be able to live somewhat of a normal pre-virus life. So please be patient as we go through this process. We have received a number of emails expressing concern, but we do hear your concerns and are working towards that return. Thank you.
Thank you, Commissioner Cook. Commissioner Mays?
Well, I think, Commissioner Cook alluded to something in our last meeting about how, we had previous commissions had built up a healthy reserve to protect us in emergencies like this, and I think that he was 100% correct. I think that we'll weather this storm better than most, but at the same time, we want to be prudent. Hopefully it's just a delay in a lot of these things and not a cancellation, and so I'm hopeful that our revenue projections will hold true, and that once we do get things going again, that they'll start to come back in again. So there's a lot of uncertainty right now, and hopefully we'll find out sooner rather than later just how much we're going to be short this year. So appreciate everybody's help and assistance in trying to get this recovery task force up and running right now. I know that there are folks at the Greater Topeka Partnership and the City of Topeka that are all working together on this with us, and I'm excited to get back in business. So.
Okay, thank you. I just echo Commissioner May's comments that we hope to get everybody back working again as soon as possible, and I know a lot of people are out there suffering, and we feel for them, and we'd like to have things back to normal again, whatever that looks like. But I think when we come out on the other side, we're going to be bigger, better, and stronger. So, and we'll be better prepared to handle a situation like this in the future. So that's all I have. So do we have a need for executive session today? None? So I guess we're adjourned. Thank you very much.
Brian
has left the conference.
Bill